This is Dr. Wright, and in this fifth and final component of the normal lung anatomy series, I'm going to discuss the vascular system. The vascular system consists of three parts: the arterial system, the venous system, and the lymphatic system, all of which have distinct morphologic characteristics. In the arterial tree, in the larger vessels, there are elastic vessels, and the features extend down to approximately 5 millimeters in size. The muscular pulmonary arteries are approximately the same size as the adjacent airway. In contrast to the elastic vessels, they have a distinct internal and external elastic lamina, and they have a muscular layer which is approximately 5% of the diameter of the vessel. The smaller pulmonary arteries have an incomplete muscular layer, and they are seen adjacent to the respiratory bronchioles and adjacent to the alveolar ducts. The capillary bed has a distinct morphology, which I will show you. Here are some examples. The larger pulmonary artery has an elastica, which is bifurcating and extends within the muscular layer. The intimal layer tends to be fine and is age-related in thickness. So in a younger person, the intima would be relatively inconspicuous. In the medium and smaller vessels, they tend to be the same size as the adjacent airway. They have a complete muscular layer, which is bounded by internal and external elastic lamina, as you can see in this micrograph. The vessels adjacent to the respiratory bronchiole and the alveolar duct tend to be very poorly muscularized, but again have an elastica which surrounds the external aspect. They tend not to have an internal elastic lamina, which goes along with their poor muscularization. The alveolus is structured to maintain gas transport in the most efficient way, and the capillaries are the largest component of the wall thickness. If one does a vascular cast, you can see that the vessels are in association with the airway tree, which obviously maximizes gas transport, and this is the vascular cast of an alveolus showing the structure of the capillaries, so that there are capillary rings and spokes which extend along the alveolus, allowing for maximum gas transport. The pulmonary veins are important, and you can remember that the pulmonary veins, the venous septa, is the boundary of the lobule, the secondary lobule of the lung. The pulmonary veins tend to have an external elastic lamina. They have slips of muscle, which is relatively inconspicuous. The lymphatics are present within the bronchovascular bundle and within the venous septa. The lymphatics obviously are very thin-walled. This is a D240 stain or podoplanin stain, the terms are synonymous, which identify the lymphatics using immunohistochemistry. So the learning points of this system are the anatomy of the arterial system, the anatomy of the venous system, the microanatomy of the capillary bed, and the anatomy of the lymphatic system. Here are your questions. Answer to question number 1. Question number 2. The answer to question number 2. Thank you. I hope you've enjoyed this fifth and final episode of the Normal Lung Anatomy series.